Juliet Farrell, case number 1.
Good morning.
Good morning, Tracy. How are you?
Nice to meet you. Not too bad, thank you.
Nice to meet you. Did you find it okay?
Yeah, directions were great.
Okay, good. Thanks for coming. My name is Juliet Farrell. I'm a Doctor of Nurse Practice student from the University of Massachusetts. Thank you for signing the consent form so that I could interview you.
No problem.
Okay. Our office hours here is Monday through Thursday, 9 a.m. to 4 p.m. and Fridays, 9 a.m. to 1 p.m. The phone number for the office is 783-1111. In case of an emergency, the emergency number is 783-2000. And here's a card with the number.
Thank you.
For you to call. I'd like to talk to you about our confidentiality policy. Everything that is said here today, or whenever you come in, will be confidential. The only exception is if you say something or it's clear that you are at risk of hurting yourself, then we may give the information to the hospital.
Understood.
Okay. What is your full name?
Tracy McIntyre.
Tracy McIntyre. Are you married?
Yes.
Yes. What's your date of birth?
7/16/1962.
1962. Do you have children?
2.
How many?
2, 1 boy, 1 girl.
Yes. 1 boy, 1 girl. What brings you here today?
My wife convinced me I need some help. I'm worrying too much.
Okay. And it's good that you decided to come, and it's good that she encouraged you to get the help that you need. Do you think you worry too much?
I think I do. I didn't think she noticed as much, but I think I do.
Think you do. Okay. When you worry, what do you worry about?
Everything. I worry at work. I worry about things going on at work, job security, whether I'm doing an effective job. When I go home, I worry about everything, including finances and whether or not I'm being an effective parent and spouse. It's just consistent worry all over.
Okay. When did this start?
Well, actually, it started a while back, but as of recent days, it's just becoming more and more.
More and more. When you first noticed it, what do you think triggered it when you first noticed?
It's hard to say. Like I said, it's been happening for so long. I can't honestly remember a time when I didn't worry about one thing or another.
Okay. What do you do when you find yourself worrying so much?
Initially, it was easy to try to refocus, but these days it's tougher and tougher to refocus. So it's like you can't really turn it off.
Okay.
And so at night you toss and turn and you just try to put it out your mind, but I guess it's causing more of a problem in the marriage than I thought it was.
Okay. Okay. Sorry. Have you ever been hospitalized?
No.
No. Okay. Have you ever been treated for this before?
No.
No. Okay. When you worry, have you ever thought of hurting yourself or suicide?
No, not at all.
No, not at all. How about hurting someone else?
No.
No. Okay. Do you smoke?
No.
No smoke. Okay. Have you ever smoked?
Never.
No? Okay. Tell me a little about your medical history.
Well, I would say it's been normal. Never been hospitalized. As far as childhood ailments, been the usual stuff like chicken pox and occasional flu, but nothing severe.
Okay. So I guess I would ask, no medication?
No
Are you on
medication.
any medication?
No.
That's it. Okay. Do you have any drug allergies?
No, not that I
Food
know of.
allergies?
Not that I know of.
No. Okay. How's your skin? Any bruises or any problems, skin problems?
No,
No?
not that I know
Okay. How's your hearing?
of.
Seem okay?
Pretty good, and a little is fading away with age because of all the loud music you listened to when you were a kid. But other than that,
Okay.
pretty good.
Okay. How's your vision? Do you wear contact lens? Or?
No.
No.
Reading
Okay.
glasses, that's about it.
Okay. Any problem with your nostrils or
No.
stuffy nose or anything? Any throat pain? Or?
No.
No. Okay. Have you had chest pains or?
No.
No? Okay. Nausea?
No.
You know, when you worry, do you sometimes feel nauseous or?
No, actually, not nausea, just more consumed by your worry.
Okay. How about any dizziness?
No.
Or difficulty breathing?
No.
Do you ever feel like someone is choking you? Any choking sensation?
No choking sensation.
Okay.
No restrictiveness anyway.
Okay. Any lightheadedness or
No.
numbness in your
None.
fingers? Okay. What about your stomach? Any abdominal pain, stomach pain?
I wouldn't go as far as to say pain. It's just maybe an occasional butterflies in the stomach because of the worry, but no pain, no pain, just a little mild discomfort.
Okay. Any problem with constipation?
No.
None. Okay. How about urination?
No.
None. Okay. Tell me about your family. Are your parents alive?
Yeah, they both still are.
They both still are. Do you have any siblings?
Yeah, we've got one sister and 4 brothers.
Okay. How's your relationship with them?
A little distant, but other than that, as well as can be expected.
When you say distant, what exactly do you mean?
Because they mainly live out of state, and so we communicate every now and then through telephone call or occasional visit. But for the most part, it's just hi, how you doing, how things going, how the kids, how the family, pretty much about it.
Okay. Do they know about your worry? Your problem with worry?
No, because you put on a brave face when you go out and you make it seem like everything is fine.
Okay. Why is that?
Because 2 things. Number 1, you don't want to admit that you're having issues with worrying, and number 2, you don't want them to worry about you. So.
Okay. Do you feel depressed?
No depression at all. No.
Okay, and you said you're not suicidal.
No.
Okay. All right. Do you hallucinate?
No hallucination.
You don't. Okay. Do you feel restless at times? I know you worry, but...
Yeah, well, that's one of the main reasons I'm here, is because at nights, like I said, you can't really turn it off, so you toss and you turn, and obviously it's not good when your wife is in the same bed, because she notices you tossing and turning, occasional talking in your sleep, so...
Okay, and on average, how many hours per night would you say you sleep?
I would say I get about 6 hours of sleep per night.
6 hours.
But as far as the really good sleep, probably around half of that, maybe 3 hours.
Okay, so do you wake up? How many times do you think you woke up within those 6 hours?
Maybe 3-4 times.
Maybe 3-4 times. Okay. Do you find yourself irritable at times? Or?
Sometimes, and I'm not sure if it's through the lack of rest or what, but yeah, sometimes.
Okay. Are you able to concentrate at work?
When I'm not worrying, yeah.
When you're not worrying? Okay. Do you feel tense?
Sometimes. Not all the time, but sometimes.
Not all the time. Most of the time?
I'd say about half and half.
Half and half. Okay. Do you have friends?
A few of them.
Do you spend time with your friends?
Do you mean to socialize very often? Well, most of my friends consist of people that are at work, and so you socialize during lunch, maybe on occasional coffee break or so, but other than that, outside of work, no.
Okay. When you are with your friends, does that distract you from the things you worry about?
It offers some temporary relief, yeah, because you're talking about other things besides what's going on in your mind. So yeah, it's a temporary relief.
Okay. How about your memory? Do you how is your memory?
Pretty good. I would say about average.
About average. Okay. I have to do a mental status exam, cognitive exam. So, what day is today?
Today is the 13th of July, of February.
Okay. Do you know what time it is?
It is probably about 9 o'clock.
Okay. 9 a.m. I'm going to tell you 3 things. I would like you to repeat them after me. And in about 2 or 3 minutes, I will ask you what are those 3 things. And I would like you to tell me. Okay? A table. So I'd like you to say table.
Table.
Carrot.
Carrot.
Chair.
Chair.
Okay. What are the 3 things?
Table, carrot, and chair.
Okay. Who is the current president of the United States?
President Barack Obama.
Barack Obama. Who was the president prior to that?
President George W. Bush.
Okay. Tell me something that has been in the news today. Recently.
Recently, there's the presidential primaries that's been going on, and all the hoopla that's been going on around that.
Okay. What, do you remember the date of your marriage?
Yeah.
Or at least the year?
1990.
Okay. Which high school did you attend?
Hartford High School.
Hartford High. Okay. Tracy, what are the 3 objects that I told you about?
Table, carrot, and chair.
Table, carrot, and chair. Okay. Do you have any questions?
No, I'm good. Just hopefully we can get this worrying under control, and I should be all set.
Okay. What I will do, I will schedule a follow-up appointment so that you could come back, see us, and at that time I will determine what the treatment plan is for you.
Alright, sounds good.
Okay. What day is better for the appointment?
Fridays are probably best.
Okay. Okay. Well, Tracy, thank you for coming in, and I'm glad that you could come and that you are taking that step.
All right. Thank you very much.
Getting the help that you need.
All right. Have a good day.
You too. Thank you.